Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. Deb Conrad is a physician assistant who was previously employed by United Memorial Medical Center in New York. In October of 2021, Deb was fired for spreading vaccine misinformation and, believe it or not, over-reporting to VAERS. She was brought into a conference room, interrogated, and was escorted out without any due process. Deb is currently suing Rochester Regional Health for damages including back pay and civil penalties in violation of the False Claims Act. So, let me give you a little bit of background. All vaccine providers were bound by their vaccine provider agreement and by the False Claims Act to report to VAERS adverse events arising from the COVID-19 vaccine. When Deb noticed several adverse events, including death, occur post-vaccination, she began writing and submitting patient reports to VAERS in her spare time, as she was supposed to do. Unfortunately, she was asked several times by her company to dial it back and to only create reports for her own patients, not those whom other providers treated. Rochester Regional asked her to toe the company line, which was to support the vaccine and reduce vaccine hesitancy, despite their legal obligation to report vaccine injuries. VAERS is a critical early warning system for vaccine injuries and side effects. This was vital for the experimental, yes, I said experimental, COVID mRNA vaccine, which was developed at the behest of the Department of Defense at warp speed. As Brooke Jackson, another whistleblower, can attest to, the Pfizer vaccine clinical trials process was fraught with fraud, waste, and abuse. Because this vaccine was rapidly pushed through the EUA process, reports to VAERS were even more imperative to protect public safety. The procedures and protocols for reporting to VAERS were clearly stated by the CDC. The following conditions were to be reported to VAERS regardless of causality and regardless of the length of time post-vaccination: death, life-threatening adverse events, persistent or significant incapacity or substantial disruption of the ability to conduct normal life functions, cases of myocarditis or pericarditis, and the list goes on. Healthcare providers are encouraged to report to VAERS any additional clinically significant adverse events following vaccination, even if they are not sure whether the vaccine caused the event. If the courts uphold the law, this will be an open and shut case. Rochester Regional clearly acted illegally and put all their patients at risk to promote the narrative. As you probably know by now, most doctors and hospitals simply cannot be trusted. You must be your own advocate. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.